For some women, changes in diet and exercise are not enough to keep blood glucose levels within the normal range, and they may need insulin. This does not mean that you have failed in any way to manage your blood glucose. It just means your body needs some extra help. You may also be prescribed insulin if you have gestational diabetes and your baby is bigger than expected for your stage in pregnancy. Insulin is completely safe to use during pregnancy. Your diabetes care team will guide you through the process and will be in regular contact by telephone to support you, especially at the beginning. There is always someone available to give you advice. You will be taught how to use an injection pen. The needles are very fine and comfortable to use. Injecting insulin will not hurt or harm your baby. There are different types of insulin, and your doctor will discuss which types are best for you and how much you need.
I found the injecting of the insulin really easy. When I was told I was going to be on insulin, my first thought was any diabetic I've ever known that injected has always done so into their stomach. And I thought, can we do that with the baby? But it was explained to me that we just do it in the top of your leg. The pens that you're given to inject are very simple, very discreet, and often I can be out and I can literally just lift my trousers to above my knee and inject and nobody would even notice I'm doing it.
Insulin injections are given using a pen with a microneedle which injects into a layer of fatty tissue just below the skin. It's simple and painless to do. Here's how. Insert a new needle into your pen. Turn the dial to select the number of units you require. Place the pen on your upper, outer thigh at a 90-degree angle. It is important not to inject in the same area every time. Push the button to inject. The dial should return to 0. Count to 5 before you take the needle straight out. Dispose safely of the needle in the sharps bin provided. If you're out and about, you should keep the needle on the pen until you can dispose of it safely. If you are being treated with insulin, it is very important to keep a tight check on your blood glucose levels. This means checking your blood glucose around 7 times each day. Before breakfast, 1 hour after every meal, before bed, before strenuous exercise, and most importantly, before driving. This will help prevent a hypo. Hypoglycemia, or a hypo, is the medical term for blood glucose levels that are too low for your body to function properly. Hypos can occur if you are treated with insulin or some diabetes tablets and may happen if you have missed a meal, or if your last meal didn't contain enough carbohydrate, or if your insulin dose needs adjusting. Pregnant women with gestational diabetes are not usually at high risk of hypos. However, you should be aware of the risks, because if left untreated, a hypo may eventually lead to reduced consciousness. Signs that you may be having a hypo include feeling hungry, trembling or shakiness, sweating, anxiety or irritability, and going pale. It is important to treat hypos immediately by having a sugary drink or some glucose tablets. Follow this up with some longer-acting carbohydrate, such as a cereal bar, a sandwich, a piece of fruit, a plain biscuit and milk, or your next meal early. Once you have treated the hypo and corrected your low blood glucose, you should still take your insulin as usual with your next meal. It is vital that your family know what to do if you are having a hypo. If you have experienced the symptoms of a hypo, you should let your diabetes care team know, as your insulin dose may need to be adjusted.
I did have a few hypos and an experience of hypos in all of my pregnancies, and I also had hypos in the middle of the night at the end of both my second and my third pregnancies, having hypos in the middle of the night. But luckily I would wake up and feel that kind of disorientated feeling that you have when you have a hypo. And would keep my monitor beside my bed.
There were a couple of occasions, whenever Joanne, was feeling vulnerable. I think the scariest probably was when I was at work. There was a couple of times I had to come home because like Joanne just needed to go to bed or needed to really just lie down and sort of try and stabilise. On the whole, we were very well advised, but hypos is, I suppose, the negative side of it, and they do exist.
Eating regular meals throughout the day can help prevent hypos. It is very important that you keep an eye on your blood glucose by testing levels frequently throughout the day and occasionally throughout the night too. Your diabetes care team are there to support you. They will be in regular contact with you to review your blood glucose readings. They will ensure that you're getting the correct amount of insulin to keep your blood glucose within the normal range and to help prevent hypos. If your blood glucose readings are high and you're finding it difficult to achieve your blood glucose targets, contact your diabetes care team as soon as possible. They will review your insulin doses. It is common for the amount of insulin you need to keep your blood glucose normal to increase as your pregnancy progresses. As with any pregnancy, it's important to be aware of your baby's movement. If you feel your baby isn't moving as much as normal, you should contact your doctor or diabetes care team as soon as possible.
Don't be scared of insulin, because I thought, oh God, it makes it sound really serious, insulin, and actually it's the best thing. I don't think I'd have got through this pregnancy without it.